A growing crisis in Kentucky has hit a boiling point. Today, we learned foster children left with nowhere else to go are sleeping in a government office building in downtown Louisville. Youth advocates call it a disaster waiting to happen and say a real solution will be really expensive. The 10-story government building sits at 9th and Broadway in downtown Louisville. It's owned by the state of Kentucky, an office building for family services. But right now it's doubling as more than just an office. It's also a shelter for children in state custody who have been told they have nowhere else to go.
Currently in Jefferson County, there's at least 1 or 2 workers each week sleeping in the office with a child because the entire state of Kentucky has said no.
Jefferson County social worker Ashlea Dodsworth addressed the issue during this year's session in Frankfort.
Our foster parents are not taking our teenagers. They refuse.
The Cabinet for Health and Family Services confirms the trend, telling us in a statement there has been a decrease in foster families who are open to accepting adolescents and teenagers with complex medical, behavioral, and mental health needs. The L&N building has become an occasional site for hosting these youth. And when they are there, the state says so is staff, social workers sleeping there, supervising.
And we are tasked as workers to tell a child as we're handing them a pillow and a blanket to sleep on an office chair that there's nowhere for them to go. And you're trying to sell it to them. You're trying to make them feel loved because obviously they're a foster child. And I've had kids look me straight in the face and say, Miss Ashley, why does no one want me?
The emotional testimony, a reality right now. Terry Brooks with Kentucky Youth Advocates says social workers are stepping into the role of caretaker all too often. And with a unique population of children facing serious issues, he fears if this continues, tragedy is looming.
Housing the most vulnerable young people in places that were never designed to house anyone. We are courting tragedy.
But the solution is complex.
What this is going to take is really looking at each kid's case individually and figuring out what mental and behavioral health supports, perhaps medical supports, social service that surround the kid. I'd love to tell you something different, but it's going to be an expensive proposition.
And one that takes time. Until then, he says we can expect to see sleeping arrangements that look like this to be common practice for Kentucky's most vulnerable kids. The state says the number of Kentucky children in foster care has decreased after peaking in 2020 at more than 10,000. Still, children are being sent out of state to get the shelter and services they need without enough resources available here in Kentucky.